Okay, continue on with the stomach. That's where we are in the digestive tract. The stomach is like a blender. So I said earlier, it's a reservoir. It can hold a lot of food, maybe 2 to 3 liters, so it's distensible. And compare that, the adult stomach, to a newborn stomach that can only hold about 30 mLs of milk. Its key function, in addition to the physical pummeling that it gives food, is chemical digestion. The goal is to create an acidic chyme that can have a pH as low as 1. Here's the anatomy of the stomach. I have 3 pictures side by side. The first picture we looked at before the break, that's kind of the view of the ab cavity when you first open it. You can barely see the stomach. If you kind of look at the middle frame, you can see everything with the ab wall completely removed, but you have to pull the liver back a little bit to get a full view of the stomach in the digestive tract. So liver, gallbladder, lesser omentum, that's the lesser curvature. That's the greater curvature and the greater omentum hanging off of it. You can see the transverse colon going right across the bottom of the stomach there. You know, a lot of times you get pain in this region. Maybe it's a cramping of the stomach or the transverse colon. This region is right around the rib cage. A lot of times you'll like go to the doc and say, oh man, it hurts right here. You kind of touch this hypochondriac region, right? Which means below the cartilage. And that's where the term comes from, hypochondriac, because they always touch this region when they go to the doctor. Oh, it hurts here. Oh. Look at all the stuff that's here. A lot of things. We're just going to talk about the stomach for now. If you look underneath the stomach, if you cut along the greater omentum and look behind it, there's the tail of the pancreas, retroperitoneal. If you isolate the stomach by removing it from the digestive tract, cut here, esophagus, cut there, duodenum, and you have the stomach in isolation. Know the 4 regions of the stomach in terms of the anatomy. Cardia, first part, because it's close to the heart. If you're to put this back in the body, let's remember what's right on top of this is the diaphragm, and what's right on top of that is the apex of the heart, right? So the region that's closest to the heart is the cardia. Always say that, you know, there's the old phrase, a way to a man's heart is through his stomach. To an anatomist, that's literal, because it literally is right there, above it. That top round part is called the fundus. I just describe it as the superior round part. If you drink a carbonated beverage, you can see like little gas bubbles there in imaging. But yeah, that's part of the stomach. Most of the stomach is the body, major part. And it's kind of like a funnel. It funnels down to this region here. There's a little angle right there. And this funnel part is called the pylorus. pylorus, the shape is different. The word means gatekeeper. There is a very strong muscular sphincter within that region called the pyloric sphincter. It's a guard, it's a gatekeeper that helps keeps the acidic chyme mostly in the stomach and only sparingly allows the chyme to pass through in small amounts to the intestine. We'll be able to identify pyloric sphincter, which is the literal gatekeeper of this region. Okay. Another thing functionally about this region is, as we'll see, throughout all the regions of the stomach, you have these gastric glands that help contribute to the acidic chyme, the gastric juices. But only in this region do the gastric glands secrete the hormone gastrin. Gastric glands in this region secrete the hormone gastrin to help facilitate more gastric juice to aid in digestion. You don't see it in other regions. Moving on with the anatomy, not only do you have these four regions, note the two curvatures. The lesser and the greater curvatures are named for the omentum that attach to them, or that's kind of the inverse. The omentum are named for the curvatures they attach to. So always associate that greater curvature on the bottom with the greater omentum. And always associate the lesser curvature with lesser omentum. In terms of the layers, this outermost layer, by just looking at the stomach, that's the serosa, and that's the accurate color of the stomach when you see it in a cadaver. That's the serosa. The muscle layers are right underneath it. And let's remember the stomach has those three layers. The three layers of muscularis externa. And they are the innermost layer, I'll go from inner to outer, and that's that third oblique layer. The oblique layer of muscularis externa. Circular layer of muscularis externa, and then longitudinal layer of muscularis externa. This segment has it windowed out all the way inside. There's like a little scope. Maybe you're checking for an ulcer, because sometimes the mucosal lining of the stomach can't protect you from all the acid that's secreted. You can get a bleeding ulcer in there. Go ahead and YouTube that if you want. You want to be grossed out. They're pretty disgusting to look at, but you got to treat it. Make you very sick. Ulcer is when the acid literally erodes into the lining of your stomach wall. Well, anyways, let's see if we can identify the layers on this picture. If I'm pointing to the innermost layer right here, what am I going for? Oblique. Okay, and look how they're The fibers are oriented next to this layer, the circular layer, wrapping a circle around it. The longitudinal layer, the fibers run more or less in this longitudinal fashion. That layer out there, the outermost layer, serosa. So we have this model in the classroom. And if you haven't looked at it, you should start to look at the model set I have for digestion. It's up there on Canvas, posted the other time. Serosa, oblique, circular, longitudinal layer. So if we look at the internal aspect of the stomach, this picture there, compare it with this picture here. The folds of the stomach have a name, they're just called rugae. When the stomach is empty, it looks all folded because it's not stretched out. As this fills with a couple of liters of food, say after Thanksgiving dinner, it's all going to stretch out. So it can accommodate all the food you chew and swallow for any meal. So know that the names of the folds are called rugae. Rugae, longitudinal folds. But also right here is the pyloric sphincter. It's a muscular, the smooth muscle can contract and shut this off. So it'll keep the acidic chyme in there, and it can just slosh back and forth as the acidic brew digests the food. Okay? And you would only let a little bit pass through a few milliliters at a time, because the next part of the small intestine is only, an inch in diameter. You can't hold a few liters like the stomach can. So you have to let the food go down very slowly. Here's a picture of the food going down. So when you're full and you haven't left room for dessert, and you have to wait for the food to go down, it's literally going down slowly, as shown here. You have peristaltic waves, about 3 per minute, something like that. And with each wave, you propel the food towards the pyloric region where the sphincter is closed. The grinding of the most vigorous peristalsis and mixing action occurs close to the pylorus. The pyloric end of the stomach acts as a pump that delivers small amounts of chyme into the duodenum. You're only letting a few mils out at a time to the duodenum in the pyloric region. It's the gatekeeper. The valve is the gatekeeper. So you can call it the pyloric sphincter. That's usually what I call it. They call it a valve here. It does function like that. And so the retropulsion, the peristaltic wave closes the pyloric valve, forcing the contents kind of backwards. You can regurgitate all the way back up here, although that's not good. That's called heartburn. Okay, when the acidic brew gets up here and causes chest pain. Normally, there's a sphincter here. It's much weaker. It should keep this closed too. Sphincter here, better sphincter here, should keep the acidic chyme in the stomach and only let it pass a little bit at a time, one way through the valve to the duodenum. Okay. And so how do you get all that juice in the stomach? It's not all the food you ate. You add juice to it for digestion, and that's the subject of gastric secretion, shown here in different phases. You start to secrete gastric juice before you even start eating. It's like we're all conscious individuals. We know when we're hungry. We know what makes us salivate. You go to the restaurant, you're hungry, you can smell the food from outside the restaurant. You go in the restaurant, you see people walking around with trays of food, it makes you more hungry. You look and see what people are ordering. All this stuff, besides the smells of food in your head, make your stomach start churning, make you start secreting acidic juices. And then, so that happens before. This phase, the gastric phase, is basically while you're eating the main course, and your stomach is full. And this is after a few hours after eating, after you're reclining on the couch watching football or whatever, it's still going on, and the food's going down. Okay, so basically, gastric secretion occurs before, during, and after a large meal. So what we'll focus on in terms of the function is the neural and hormonal mechanisms that get the stomach to secrete gastric juice. The secretion of gastric juice includes neural and hormonal mechanisms. Let's think of the molecules that accomplish neural and hormonal mechanisms. If there's a neural mechanism, you're talking neurotransmitters, namely ACH. So what I'm saying is ACH can stimulate the gastric gland to secrete juices. Now these glands are in the stomach wall, and I've defined the stomach wall. They're in the mucosa, these glands. They're in the mucosal layer. The hormonal mechanism is gastrin, like I mentioned before. All I'm saying is either ACH or gastrin will stimulate the gland in the mucosa to secrete all that gastric juice. Either before you start eating, called the cephalic or reflex phase, that's why I say all in your head. You're not eating yet, you're just thinking about eating because you're hungry. That gets the juices flowing. The gastric phase is when you're actually eating. The most juice is released here. So if you eat properly in different courses, the appetizer is supposed to get this going. So a little bit of food will kind of get some gastric juice going. So when the main course arrives, digestion will be more efficient. Okay. And so food in the stomach will trigger some of the gastrin release in the pyloric region. In the intestinal phase, your stomach is full and it's starting to empty into the duodenum. Right? So the acidic chyme will trigger more release of gastrin if the food that reaches the small intestine is not completely digested. You'll get more gastrin released. So gastrin is a very important hormone in this digestive process here. So let's talk about the details of what happens in each phase. So first off, before you start eating, let's look at what I mean by gastric juice, these three things. Whenever I say gastric juice, think about the gastric gland. What are the cells in the gland of the mucosa that secrete the juice? Mucus cells, sheath cells, parietal cells. And, well, I think for mucus cells, it's obvious what they secrete, mucus. Mucus is a great protective barrier to stomach acid, to protect the lining of the stomach. Sheath cells secrete pepsinogen. That's the inactive form of pepsin, which can help digest proteins in the stomach. I mentioned that earlier. The parietal cells are acid-secreting cells. They secrete good old HCl. So the gastric juices to me is this. When people say juice, it's all three of these things. And the cells that secrete them are important. And what I'm saying is ACH and gastrin will stimulate these cells. They both stimulate those cells. Now, think about it here. You haven't even started to eat yet. So this is all just happening neurally. Okay? You're just thinking about it. However, when you actually sit down and you're like an hour into your feast, your stomach is full. So things that are happening when your stomach is full, it's stretched. The stretch or distension of the stomach will trigger the ACH to release juice. The physical stretching can do it. So you put distension. Distension means stretching. You'll get some ACH release. And as food reaches the pyloric region and it's partially digested, those partially digested peptides will have the release of G cells. Those will secrete gastrin to facilitate more gastric juice to increase digestion. So, we have one thing here. The entering endocrine cell. This figure just calls it a G cell, much easier to spell. You should know both terms. They secrete more gastrin, but again, you only see this in the pyloric region. But they would be a part of this gastric gland that I'm presenting to you, but only in the pyloric region. If partially digested peptides present themselves to the pyloric region. Pyloric region only. Okay? But gastrin will help facilitate more gastric juice. It's a long phase, 3 hours long, so it keeps on happening well after you're done eating. 2/3 of all gastric juices are secreted during this phase. So let's take a look at the gastric gland before we proceed to the last phase, the intestinal phase. So what you see here in the illustration is the full stomach lining from inner to outer layers. Mucosa from here to here, the submucosa from there to there, and then you have 3 muscle layers of the muscularis externa, oblique, circular, longitudinal, with serosa on the bottom. Notice that the gastric glands are folded all in the mucosa. Okay? Notice that the surface is pitted like gopher holes. Those gastric pits may lead to several gastric glands. This one is showing 1 to 1, but it's usually one pit to several glands. So the gland is from here to here. Look at the surface epithelium. Like you have all these like gopher holes, right? Well, what you can't see is, like if you look deep inside, is that one pit may lead gastric pit may lead to few several pending gastric glands. So don't confuse pit and gland. You have to identify both on histology. All right. Here is just showing you the pit and the gland. The pit leads to the gland, pit on top, glands on the bottom, and you should be able to identify some of these cells. So let's closer up view of just the gland right here. Here's the gland, and you would secrete into here. It'll pop out in the lumen. Be able to recognize these fuzzy pitchfork cells. Those are the parietal cells. Those are your acid secreting cells. So if I just were to draw that cell, they're all cells in here. What we'll see is that these acid secreting cells will secrete the hydrogen and the chloride ion separately, and it'll form HCl in the lumen of the stomach. I mean, that way you don't digest as you're secreted, right? You just digest yourself. You form HCl until you get to the lumen. Notice how you have this fuzzy pitchfork design for more surface area. Okay. In a stomach at rest, the pH is something like 4 to 6. If it's activated because you're eating, an active stomach, like I said, it can get as low as 1, but usually 2 to 3 is considered quote unquote active. You're digesting food. And that's important to know because with pH less than 3, you activate pepsinogen. Pepsinogen are secreted by the chief cells. Pepsinogen is the inactive form. Low pH activates it to its active form, pepsin, which digests proteins in the stomach. So low pH, less than 3, you get pepsinogen converted to its active form, pepsin, in the lumen of the stomach, or it's acidic. Okay, so no, I already wrote it that the chief cells are called pepsinogen. It's the most numerous. It's the chief cell. The chief cell is the chief cell, right? Because it's the most numerous. So maybe I'll use a different color. How about red? So the chief cells secrete the pepsinogen. Now the chief cells are also called peptic cells. So peptic or chief cells secrete the pepsinogen, convert it to pepsin, digest proteins. The other cell I said that secreted mucus is not shown here because the mucus cells are more or less at the neck of the gland. And we're looking way down here. So mucus cells at the neck. Kind of more the neck region. And deep inside the gland, in the pyloric region, these green cells are those G cells or enteroendocrine cells that secrete the gastrin. Deep inside, you got a few of them. Enteroendocrine cell. They secrete the gastrin. So all those cell activities and their secretions, know them. Illustrated for you quite nicely in the Mariev textbook. So again, closer up, chief cell, purple on this slide. Got these mitochondria inside the parietal cell because you're pumping against the gradient. Enteroendocrine cell is green. close-up picture of just the parietal cell, the fuzzy pitchfork. So not only do they increase their surface area by having this fuzzy pitchfork design, they can even increase their surface area 100-fold more when they're activated. Okay, we don't need to go into that detail. Just know that they secrete the hydrogen ions and the chloride ions separately to form HCl and lumen. Also, there's this called this alkaline tide, where you exchange negative for negative, and you pump out a lot of bicarb into the interstitium, and that actually helps form a protective barrier on top of the epithelial lining. In addition to the mucus, which is a physical barrier to stomach acid, pH 2, the bicarbonate that's excreted is a chemical barrier that makes the pH neutral at the cell surface. Okay, so you got mucus and bicarb protects from ulcer. All right, so now that we've seen the gastric gland, let's kind of like look at the intestinal phase. The intestinal phase, this is where it can kind of give you a headache, because look at all these hormones you got to know. Okay, it's all about the hormones in digestion. Particularly in the intestinal phase, you're receiving all of this food that you just ate. And how does the body respond functionally? Mostly through hormones. So the intestinal phase is really the hormonal phase. Generally speaking, food that reaches the duodenum, it negatively feeds back on the stomach. It wants the stomach to slow down, because once it starts to receive food, it can't distend very much. So it really needs the stomach to slow down so it can do its job better. It can't receive too much at once. Negative feedback on stomach churning. As well as acid secretion. Putting on the brakes. You're trying to inhibit the stomach. Trying to slow it down as it empties into you, into the duodenum. So it depends on, the hormones that are secreted depend on what's in the chyme, what's in the food you ate. Chyme contents, reaching duodenum. If it happens to be, say, lipids and proteins, what PRO for proteins, that'll be a stimulus for the intestinal cells to secrete the hormone CCK. The full name is cholecystokinin. Means, chola means bile, cysto refers to the gallbladder, well, kinin means move. So basically this is a hormone that means, the name of it means move bile. I usually call it CCK for short. So the function of this hormone, one, it will be stimulated to be released into the bloodstream. One of the places it goes, I put a picture here to remind myself. It helps stimulate gallbladder contraction. Now the gallbladder doesn't produce bile, but it does store it and concentrate it. So CCK causes gallbladder contraction. Now I haven't taught the biliary system yet, but the gallbladder is connected to a system of ducts. You squeeze the bile out, it's got to be able to drain into the duodenum. So you can't see it here, I'll show it later. There's a very small sphincter, there's a little outlet that squirts bile into the duodenum, but it's got a sphincter around it. So you have to reduce the resistance of that duct, of that sphincter, so bile can squirt out. So at the same time as CCK causes gallbladder contraction, it relaxes what's called the hepatopancreatic sphincter, so bile can be moved. So I'll add to the list, relax, what's called the hepatopancreatic sphincter. Hepato refers to liver. Pancreatic obviously refers to pancreas. Sphincter is just the little valve that opens and allows this juice to flow into the duodenum. But in addition to moving bile, it makes the pancreas secrete these pancreatic enzymes that will further aid in digestion. So you stimulate pancreas to secrete this enzyme-rich juice that comes from the pancreas. Remember, the liver and pancreas are accessory organs of digestion. They're not in the digestive tract. But this is one of the places you secrete into it. So all of that is done by CCK. Know the function of CCK. Gastric inhibitory peptide is next. If you have lipids and carb, lipids and glucose, I'll call it GIP for short, gastric inhibitory peptide. That hormone, in addition to its name, will, inhibit the stomach, but not apparent. It basically will stimulate the pancreas to release insulin. Sorry, that says glucose, got rubbed off. Stimulate insulin release from pancreas. Another thing, the other major hormone that's released is secretin. The acid in the chyme will trigger the release of secretin from the intestinal cells. The secretin, like the name implies, is a big one. It will make the liver and the pancreas secrete stuff. In the liver, it'll make it produce bile. Bile production. And in the pancreas, it'll make the pancreas secrete this bicarb-rich juice for acid neutralization. So that's secretin. I would put check marks next to secretin and CCK. Those are the ones we ask you about the most. I guess we being me. Those a lot. But know these other ones, GIP, but also put VIP, vasoactive intestinal peptide. Basically, chyme itself will trigger its release. Vasoactive intestinal peptide will dilate intestinal capillaries because you got to absorb the food that you ate, and I call it the food coma hormone. It makes you sleepy. All the blood rushes to your intestines. And the last one is if the food that reaches the intestine is barely digested. If partially digested proteins reach the duodenum, so I'll squeeze it down the bottom here, partially digested proteins, then you get more gastrin. You get more gastric juice. This is the only one. I'll kind of box it because it's not like all the other ones. All the other ones, their goal is to inhibit stomach churning in acid. But if you need more gastrin because you're chewing your food too fast, you're just chewing and swallowing, or barely any chewing, and then you're not digesting your food all the way. You need more gastrin from the small intestine to help facilitate more of this. So all the other ones inhibit stomach churning. This is the only one that will increase it more if you need it. So you get gastrin both from the stomach and the small intestine if you need it. You know, we can pick it up here next time for lecture.